So we call upon Dr. Kavita Ranjan Bhatnagar. Sorry, Kavita Rajan Bhatnagar. And the topic is to compare obstructive sleep apnea among patients with and without diabetic retinopathy.
Stop? Yeah. Okay, good afternoon, everyone. Thank you, AIOC, for this opportunity. I have no financial interest, no conflict of interest. The topic is to compare obstructive sleep apnea among patients with and without diabetic retinopathy. The proposed mechanism of how OSA can be a risk factor for DR is that it leads to chronic hypoxia and activation of oxidative stress pathway and formation of AGs, and these AGs are responsible for various microvascular changes of diabetic retinopathy. The objectives were to compare OSA in patients with and without DR and to assess the correlation with blood pressure, blood sugar levels, HbA1c, lipid profile, and 24-hour urine protein in the two groups. The study included 85 patients, 45 DR, 40 no DR, and 19, 6, and 20 with mild to moderate NPDR, severe, and PDR. 14 had DME. All underwent assessment for OSA using stop bank questionnaire and Epworth sleepiness scale. The grading was done as, and all the high-risk OSA patients based on stop bank and Epworth sleepiness scale underwent polysomnography. And then calculation of apnea hypopnea index, that is AHI. Based on AHI, they were classified as mild sleep apnea if the events were 5 to 15 per hour, moderate sleep apnea with 15 to 30 events per hour, and if events were more than 30 per hour, they were labeled as severe deep sleep apnea. So these are the questionnaires. Due to paucity of time, I'm not going to read out the questions, but it was labeled as high risk if yes response was 5 to 8, intermediate if it was 3 to 4, and low risk of OSA if the response was 0 to 2, and total score of more than 10 was taken as abnormal on Epworth sleepiness scale. Longer duration of DM, high HbA1c, LDL HDL ratio, proteinuria, and use of insulin were significant risk factors for DR, and high odds ratio shows high risk of OSA in DR patients. Also, high odds ratio shows high risk of OSA in PDR patients, but not statistically significant. OSA did not have association with DME. So on stop bank questionnaire, a longer duration of DM, LDL, BMI, and hypertension were significant risk factors. And on Epworth sleepiness scale, again, BMI and hypertension were statistically significantly associated with severe OSA. Based on this polysomnography results, in our study, 2 had mild sleep apnea, 1 had moderate, 5 had severe sleep apnea, and 1 was negative out of the high risk, 9 high risk patients. Though there was no significant causal relationship between OSA and diabetic retinopathy, but progression was definitely associated with it. High odds ratio might be due to similar risk factors for the two diseases. So to conclude, OSA could be screened as an independent risk factor in evaluating diabetic patients, especially in patients with uncontrolled progression of DR, despite controlling other metabolic risk factors. Longitudinal studies with observation of effect of treatment of OSA on DR status could better establish their relationship. It was not included in the slide, it was missed, but we did assess the oxygen desaturation index also, which was found to be higher in DR patients compared to no DR patients. It was higher in PDR patients compared to NPDR patients. And oxygen saturation was less in DR patients compared to no DR patients. Though the OSA patients, high-risk OSA patients have not undergone treatment, but we are following them up. And post-treatment, again, we'll reassess them, and I think maybe we'll be in a better position to comment on, the causal relationship. Thank you.
Thank you, ma'am. I think it was a new thing which you did. But only PSG was done only on 9 patients out of all the patients. Like since your study was on sleep apnea, so I was just wondering if it could then be done in all the patients.
Actually, the original plan was that, but you know, the technical problems. We don't have technically trained manpower, and they didn't allow my resident to do it alone. You know, they didn't want to hand over the machine to my resident, so then we, you know, restricted it to only the high risk.
And
So these are the limitations.
Oxygen desaturation was done one time?
It was done one time, and now, I mean, the plan is to do it on follow-up after treatment.
Thank you.
Thank
Thank
you.
you.